This is the award-winning Lee Pitts Live.
Brought to you by the North Law Firm. For car accidents and negligent security cases, call Joe at 239-337-1191. By Crime Stoppers of Southwest Florida. Report crimes and get paid with nobody knowing your identity. 1-800-780-TIPS. And by Lee Health.
Good morning, Southwest Florida. Welcome to another edition of Lee Pitts Live. Who me, of course, I'm Lee Pitts, the host of the show. And where are we? We're at Shell's Special Touch Restaurant, one of the finest restaurants in Fort Myers. You want to Google them, find out all about her wide range of cuisines as well as her catering business. Chef Michelle, the official restaurant for Lee Pitts Live. We have a thrilling show in store for you today. We're going to get a chance to talk to Latoya Crispin. She's a practice manager for Lee Community HealthCare. We'll also get a chance to talk to the good doctor, Dr. James Belcher, the physician for Lee Community HealthCare. That's the healthcare right there on Martin Luther King Boulevard in Dunbar. Also on our show, we'll get a chance to see an awards presentation for one of the Lee Pitts Live Persons of the Year. It's all taking place in the second part of our show. We'll be right back. Southwest Florida, you're looking live at one of the finest restaurants in Southwest Florida. That's Shell's Special Touch Restaurants. Certainly Google them and look them up. And also you can go to the Lee Pitts Live website, go to our partners page, tab down, you'll see their logo, click on it, and you can make your orders there as well. They cater, do takeouts, walk-in, full-service restaurant, everything right here in the heart of Fort Myers. Speaking of food, you want to eat healthy, you want to live a healthy lifestyle. So we got some people here who are in the world of health. Let's bump you in if you don't mind. We got the good doctor here, Dr. Belcher, and we have Latoya. Welcome to Lee Pitts Live.
Well, thank you.
It's your first time on the show. Certainly won't be your last. You guys are doing some wonderful work in the community. We're just thrilled to get you here. Let's find out a little bit about each one of you before we get started. Tell us a little bit about your doc and what you're doing.
So my name is Dr. Belcher. I just came to the area about a year ago. I've been blessed to be up at Dunbar. I really enjoyed the time there. The patients there have just been a wonderful place. I'm a family medicine doctor. Been doing it for about 10 years or so.
Okay.
Really like it.
Man, I thought you were a teenager, man. You've been doing it 10 years, the baby face. Here's another baby face. The practice manager, what does that mean?
Well, what that means is that I manage the daily operations of the Lee Community HealthCare offices, and I have been doing so for the past 7 years, and been a pleasure to manage the clinics that we do and provide the service that we provide to our patients right in the heart of the community. Now,
your clinics are stationed throughout Lee County?
Correct, yes.
Give us a general concept.
We have an office that's in Cape Coral, next to Cape Coral Hospital. We have an office in North Fort Myers, our Dunbar office, and then we have an office in Lehigh as well.
And I was talking to Bob early on. It seems like it's going to be some expansion in the future as well, and we'll keep people abreast of that. So these types of healthcare facilities keep people from going to the emergency room, and they can get some many minor things taken care of. Doctor, specifically in the Dunbar community, you're going to be now servicing children as well. Elaborate on that, if you will.
Yeah, so one of the things we really wanted to do since we've been down here is to expand our services to be able to get, starting with adolescents into the office. It's kind of a critical age. We've got a lot of things going on with immunizations and getting into middle and high school and social or emotional issues that you need to deal with, and it's really a good age to kind of get them in, get them a home, and then as a family medicine practice, we can take them into adulthood and continue to follow them through their life if they're
great. That's helping to provide a lifetime of healthy going into a healthcare facility. Just to share a little bit with you guys to humanize this, I grew up in low-income community. My mom raised 7 children by herself. Essentially, we were on poverty, and it was a long time before we started getting medical care. But eventually, we got on Medicaid when I was in my teenage years. But a lot of things that had gone on in our family in terms of our bodies that could have been taken care of when we were younger if we would have had access to health care at a young age based on our income. I said all that to say that your facility, income shouldn't be a major factor in people getting proper prenatal care and all types of care.
Yes.
Go.
Yes. So I've been extremely impressed with how the Lee Community Health has done as far as providing income to anybody who needs it. And they have a lot of good programs for people who are lower income, who can't afford insurance based on certain criteria. They do a really good job of taking care of them, just like they did, as well as any other patient that would walk it through the doors.
Now, when I hear that being said, Latoya, that speaks to the whole process to me of everybody at least getting decent health care in their life, regardless of their income. Go ahead with that.
Correct. So we do have a process for our uninsured patients. We have what's called a registration appointment, and they meet, their very first appointment is with a financial counselor so that we can review their financial household income and also verify residency, because currently our uninsured sliding scale program is for uninsured patients of Lee County residents only. And so once we get them, once they complete registration, we take their income and see where they fall on a sliding scale. Our sliding scale ranges from co-pays as low as $10 ranging up to $35.
I see.
And one thing we do, our goal is to keep people out of the emergency room. And so if someone were to come in and they didn't have that $10 copay at that time, we would never turn them away. We would continue to see them.
Well, that's great to have an organization like that in the community.
Yeah.
Adolescents, we alluded to them earlier, but it's very important that adolescents get early medical care so they can grow up with a healthy lifestyle. Why is that so important, doctor?
Well, you got a couple things going on. It's around age 11 or 12 is when a lot of immunizations come into play. There's a lot that you can do at that point to help prevent things like infectious disease and even types of cancer, cervical cancer at that age. So it's important to get them in there. But also just, I found that age group, there's a lot of issues going on, whether it's at school or home, that cause anxiety and just mental health problems with kids, that it's really a critical time to get to them before something, before it snowballs and goes downhill. And
what are your office hours?
We're open from 8 to 5.
Okay.
And then we have some extended hours on Tuesdays and Thursdays.
Okay, would that apply to all of your?
Yes, all of the offices are open Monday, Wednesday, Friday, 8 to 5, as Dr. Belcher stated, and then Tuesdays and Thursdays, 8 to 7. At our North Fort Myers location, we are open every Saturday from 8 to 12.
When somebody gets logged into your system, become a patient, they have access to the same doctor or somebody very similar, and in emergencies, that would be the person they would put on as their primary care physician, right? That's good to have.
Yes, correct. Once patients establish care with us, we become their primary care office, and they are assigned to a provider such as Dr. Belcher. We also have physician assistants and nurse practitioners as well that can see patients. One of the great things about us having multiple locations is that if Dr. Belcher's schedule is full and he has a patient that needs to be seen that day, they can see another provider in his office or at one of the other Lee Community Healthcare offices as well.
Right, I like what I'm hearing, Dr. Belcher, because it was only until I was out of college that I had a primary care physician. I take it for granted now, of course, but lifestyle has changed. But a lot of people don't have a primary care physician. They're just kind of dangling through with their life. Expound on how important it is to get a primary and get yourself under that umbrella of healthcare.
Well, it's good to be established and to get in at least every year or so. Even if you're young and healthy, there are things that we can do to just kind of make sure things are staying, that your health is in a good place and staying there. It's not something you have to come in and do every month or 2 months or 3 months, even if things are going well. That's not what the aim is. The aim is to make sure that we can get your health the best it can be, and then if something does happen, you have a place to go and you don't have to wait and try to find a doctor when you are in an acute situation.
Now, Lee Community Health, that is still a place to go for your annual checkups, though. I go and get an annual checkup.
Yes.
That's still, what does the annual checkup consist of? I know we're talking about adolescents, but I want people to know also adults still can take advantage of these offices as well, right?
Right, yes.
Before I do that,
yes,
all of the offices are servicing adolescents as well?
Currently, our Lehigh office services infants going up in age to adults. And then our Dunbar office, starting on Wednesday the 20th, we will be servicing ages 12 and over. And then a few months down the road, our North Fort Myers office will be serving ages 12 and over as well.
Great information. We see your website and phone number on the screen. You remember that long question I asked you? Yes. Go ahead.
Okay. So what we're going to do at an annual visit is going to be based on your age. So when we're talking about adolescents, you're talking more about immunizations, making sure they're the weight and blood pressure are still good. And then as you get a little bit older, we aim more for the weight, blood pressure, start looking for diabetes, cholesterol, those sort of things. So we have different guidelines that we go through the ages, and it changes, so it's important to get in.
What does it do for you personally to be able to service the underserved community like that and be able to provide that health care that people wouldn't normally get?
You know, Lee, I've been blessed my entire life, and I've been looking for a place where I can help people in the best way possible. And God's brought me here. I've been blessed to be here, and at this time of Thanksgiving, that's what I'm thankful for, to be in a place where I can help people.
All right, it's beautiful to hear. How about you, Latoya? Same question.
Same as Dr. Belcher. I've been very fortunate throughout my years here on Earth, and I do feel that this is my calling, working in community health, and just happy to give back to the community here in Lee County any way that we can, and to be able to provide medical care for so many who thought that they could never have it because of they were uninsured, they were unemployed. The fact that, you know, our mission is to serve the underserved is what I feel that, as Dr. Belcher stated, God has called me here, and this is my purpose. And
see, I love humanizing you guys, right? Hey, let me get one more question in. We know the terminology of copay. Usually when I hear the terminology copay, it's associated with my insurance. There are still people who can come to you who do have insurance, okay, and there's a basic copay. Tell me how that works, if there is, and how it's scaled out. Would that be you, or go ahead?
Yes, we see insured and uninsured. Insured, pretty much, the copays are determined by the patient's insurance, and so legally we do have to, whatever the patient's insurance says that's what their copay is, that's what we are bounded legally, that's the amount that the patient has to pay. As far as for our uninsured patients, it is based on federal poverty level, so again, it's pretty much based on household income, how many members are living in the home. And we take that and we plug it into our table, and the table will determine what tier that patient falls into, which is what their copay would be, so to speak.
I see. Now, Lee Community Health Care, that's associated with Lee Health, right?
Yes.
So we know that we got this big medical concern behind all of this, and we so top-notch medical care, top-notch equipment, state-of-the-art everything, and if necessary, the patient can be routed into the bigger machine.
Absolutely.
Yes, definitely. And the way that Lee Health supports the community health care and the resources they put behind it, you can really, it's really remarkable. And I've been seen a lot of different clinics and how things are done, and especially with lower income, and the amount of support that Lee Health gives, it's very impressive.
Okay, shout out to Lee Health. Well, it's been a pleasure having you both on the show.
Thank you.
Looking forward to getting you back in the future, and maybe even bringing my show out there and getting one of those small rooms and do some fun in there and let you check me out, check my blood pressure and all that.
Absolutely.
I need to get it down a little bit there, but my cholesterol is great, Doc.
Good.
A whole lot of the cardiovascular stuff has turned out great. At my age now, I'm getting got my colonoscopy. Good. No, I'm keeping up with things like that, so I can talk a little bit. Let's bump you out. As the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those like these fine people here from Lee Community Healthcare who are doing it. We'll see you.
Lee Pitts Live is a Lee Pitts Enterprise production.
Hello, everybody. I'm Lee Pitts. Thanks for watching our show, Lee Pitts Live, right here on Fox 4. We're so delighted that you've been tuning in to us for the past 28 years, and we're just moving forward, continuing to bring you excellent programming. You can now watch us on YouTube at your convenience. Just click on the subscribe button below us and watch Lead Pits Live on YouTube and streaming live, all types of ways. That's Lead Pits Live on Fox 4. We'll see you.